Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director, providing you the update from Albany Medical Center. Today is Tuesday, June 30th. We'll pick up where we always start, which is with the numbers, and let's take a look at the first graph, which is looking at activity in the 8 counties of the Capital Region. You can see, Fred, it continues to look just like it did last week. There are 36 people currently in a hospital bed in those 8 counties with COVID-19, and of those 36, 4 are in an ICU. So that continues to be a good news story.
Great.
Let's put up the second graph, which is activity inside here at Albany Medical Center. Admissions above the line, discharges below the line. You can see over the last 7 days, we've had a total of 10 patients come in the hospital. We've had 11 who are discharged. So the net of that is about 1 less than we were a week ago. And now the third graph is the actual morning census. These are people sitting in beds at Albany Medical Center diagnosed with COVID-19. And we currently have 18 in the hospital, 17 are on the floor, 1 in the ICU, none on ventilators, and of course about half of those people are positive but not clinically active.
Waiting to go back to their nursing home or group home.
Another number which people are curious about are the ages of those patients. We've heard a lot of recent news stories about younger people getting COVID. I can tell you of those 18 that are admitted to the hospital here, we currently only have 2 under the age of 40. So the majority of them still are people in their 60s or above.
Still the older population here in the Capital Region.
Staying on the COVID theme, one of the things we'd like to talk about is our campaign to have people socially distanced by 6 feet using these signs. I think people are familiar with these. This one in particular was designed by our own Lori Hansen, who's incredibly talented. We've seen her work here before. In addition, I'd like to call out that this was another time we've partnered with NYSID, the New York State Industries for the Disabled, and one of their member organizations, Spectrum Designs. And Fred, Spectrum Designs has as its mission employing people with autism to make sure they have a full and productive life. And they're not for profit, and they're in New York State, and so they helped with the production of these. And so it's another great example of where that relationship with NYSID and Spectrum Designs is something that's benefited not only us, but the people that they employ.
These are incredible, Dennis, and we've ordered 1,500 of them.
Yes.
You're going to see them around the hospital helping people when they're lining up either to come in to visit or to get screened,
yes,
to know how far to stand apart.
So and we thank obviously NYSID and Spectrum Designs for their great work. Now, Fred, you mentioned using these at the check-in area.
That's right.
And so this leads us into the question of the travel advisory, because we have a lot of people coming in who may have traveled.
That's right. So, Dennis, we said last week that the governor put another executive order out on quarantining people who are coming from states with very high incidence of COVID.
Right.
So if you come from one of those states, and now today he added a bunch, so there's 16 states on the list, you need to quarantine for 14 days. And if you fly from one of those states at the airport, they're asking you about your travel and asking you to fill something out, etc. So for healthcare workers, this is a little unique and a little bit different. So for healthcare workers, we need to screen them. And screening is asking those questions, yes, but also within 24 hours testing them for COVID. So we've set that up. A messenger is going to go out for our staff. We have a policy. The messenger will describe how to go about doing that. If you're asymptomatic, you'll be able to work for 14 days, but you'll have to be screened twice a day for all the symptoms of COVID. If you develop symptoms, you have to go home.
Okay.
Right. And you can't work until you've been asymptomatic for a period of time after that. So those policies are set. Actually, we've reviewed them this morning, and we're going to go ahead and implement them. It has implication for visitors as well, because now when you're standing on one of these circles, we're going to ask you a series of questions, including have you traveled out of state? And if the answer is yes, then we're going to run through the list of states. And if you've traveled to one of those states, you won't be able to come and visit here in the hospital.
All right. And
so major implications for us.
Major, and of course it's going to change. The state list may grow, it will shrink, it will change. We're going to have to keep up with that, and we'll use this forum to talk about that.
Absolutely. There's a website that we'll be able to look at, and actually anyone can look at. And we've been told by the state that even on a daily basis they might update that.
All right, very good. Now, you mentioned testing, and I know that the medical staff and the clinical leadership have recently come up with a new order set in our electronic order about testing for COVID.
So, Dennis, we're trying to make it easier. We want to understand why testing is being done and if precautions are necessary. So the first kind of test is if you expect somebody has an acute illness with COVID, and that immediately is linked to the right kind of precautions. The second test is for the congregate living population or this travel population.
Okay.
So if you're a patient in the hospital and you've traveled, let's say, to North Carolina and back, then you would be in the second category, where depending on what's expected, you can also be on precautions. The third category is testing that's purely done for surveillance. So there's no expectation that you're at higher risk or that you have the disease, but we feel compelled to test you. And that population is not going to go on precautions. So 3 different tests that will give us a little bit better control over precautions, a little bit more safety in how we care for these patients.
And this order will go live
I think it's going live today.
today. They usually go live on
Tuesday
Tuesdays.
night. Yep.
Okay.
Tuesday night it'll be loaded.
All right. Well, very good. And thank you to everybody who worked on getting that in place. And then, Fred, I think people who watch these videos will recall that when we delayed medically necessary procedures, at one point we were thousands, maybe 6,000 cases behind.
Yes.
And we've been slowly now making our way back and doing those cases. One of those efforts has included doing cases on Saturdays over at South. And I think we have some ideas about doing some more of that.
So the cases on Saturdays at South Clinical have been a tremendous boom. So we've been able to do, I think this past Saturday they did 8 cases. They've done as many as 15 on a Saturday. Very well received by patients and family, very convenient, and the surgeons, I think, like this as well.
Yes.
They're able to work through their backlog. So we're going to continue that, Dennis. But probably at the end of July, we're going to start doing Saturday cases here at the Main. Now, we always do Saturday cases, mostly urgent and emergent kinds of cases, but we're also going to start to layer in some electives, again, to try to work through some of the backlog. So we're in hiring mode.
Yes, we are.
We're looking for nurses and surgical techs and others who want to work on weekends. So if you're interested out there in a weekend gig here at the medical center, give us a call.
We have a lot of members of our clinical team who actually like the weekend track.
Absolutely. We have people who work 52 weekends a year.
52 weekends a year.
Yeah,
So
yeah.
there could be an opportunity for that.
Yeah, absolutely.
But a chance to come and work in our ORs here on the weekend would be great. So
Absolutely.
You mentioned the different disciplines that we're looking for.
Yes.
Great. Okay, very good. Finally, we'd like to acknowledge that Diane Carey, after 15 years, is leaving Albany Medical Center, and we'd like to say a couple things about that.
Yes, Diane was a nurse here for 15 years. She was the interim chief nursing officer. So we wish her well. We're going to begin a search to replace her. We're going to do that in a very inclusive way. We're going to reach out to multiple different individuals in the organization to get some information and thoughts on it, including some of the nurses.
Okay, very good.
And we'll come on that.
We'll be kicking that off,
Yep.
right. And I also join Fred in wishing Diane the very best. We'll be back again on Thursday. I think we have some exciting news about the system to talk about in a couple days. So we'll be back then. Until then, we ask that you please take care of yourself, take care of each other, and we'll see you on Thursday.